My name is Dr. Chrsitina and I am a OBGYN. I am actually from the upstate. I'm from Greenville, South Carolina. My parents live in Greer, South Carolina still. I went to high school here. I have my undergraduate degree from the University of South Carolina, and I went to medical school at Medical University of South Carolina in Charleston. I chose to be an OBGYN because I really enjoy working with every aspect of a female's life, of a woman's life. I enjoy working with very young patients all the way to the elderly population as well, and I get that breadth of practice being an OBGYN. I'm also a surgeon, so I work in the hospital operating, also have the distinct privilege of delivering babies, all of which that I enjoy. So getting to have all of those aspects and working and taking care of females has been a joy for me. Taking care of my patients has been the utmost priority and privilege and joy for me. New things are coming out every day. We're learning so much more new information and how we can better take care of patients. There's just new groundbreaking research that we get to apply every day that I find really interesting, and am very lucky to be kind of a part of, to get to apply that brand new information, brand new research every day to our patient populations. My top skill that I do like working with it, or that I do, would be operating. So I am robotically trained. I can use the robot to do minimally invasive surgery, and I hope that we're bringing that technology to the future at Oconee Memorial Hospital. My style, I invite the patient to be very hands-on, and they are a critical part of their healthcare. So my style is working very closely with the patient for their health, and I invite my patients to be a part of the process. I was very interested in coming back to the upstate and coming back to be closer to family. I previously was in a big metropolitan city and very large hospital and very large, a lot of patients. I didn't feel like I could give my, I didn't feel like I could be very personable. I was just seeing a lot of patients and being in a big hospital. So when I saw the opening for Oconee Memorial, I felt like it was the right place for me, because it's a smaller hospital, work closer with patients, and have that more personal relationship with patients. Interests, I love to exercise, love to travel. One thing that's interesting about me is that I tell my patients is that I'm a twin. I'm a twin. My mother's a twin. My mom's twin had twins, so we have a lot of twins in the family. I love taking care of patients who are going to have twins, and so that might be a little known fact. But otherwise, my hobbies are exercising and traveling. I'm a homebody, relaxing at home with my partner, and yeah. The advice that I tell my patients that I see them really taking home is to be an active part of their care, to not be a bystander in their own health care, to ask the questions that if they don't understand anything, to be a part of the decision making. Don't make sure that their needs and wants are heard and met, and that they are really an active part of their healthcare, not a passive member of their healthcare. If you'd like to make an appointment with me, you can do so by calling the number on this webpage.